spoon excavator has a very long shank that allows the instrument to reach into the coronal portion of the tooth. The spoon end excavator removes deep caries, pulp tissue, and a temporary cement. The double end instrument has right and left end. Endodontic Explorer. The Endodontic Explorer is designed to help locate canal orifices, openings. It is a double end instrument with long tapered end that have sharp points. This stiff end explorer is designed specifically for endodontic procedure. Endodontic spreader, plugger, and the Glick number 1. A spreader and plugger condenser is an instrument used to laterally condense materials when obturating sealing filling the canal. Both these instruments have long tapered working end. The spreader are pointed on the end while the pluggers are flat. Both these instruments have instrument metal handles or finger-type plastic handles. Spreaders are used to adapt the gutta percha into the canal, lateral condensation. Pluggers are used to condense the filling material to provide space for additional gutta percha cones. The Glick number 1 instrument is used to remove excess gutta percha from the coronal portion of the canal and to condense the remaining gutta percha in the canal opening. Endodontic materials. Endodontic materials are substances used in endodontic procedures to dry, fill, or treat the root canal. The dental assistant should be aware of characteristics of the various types of materials used. Absorbent paper point. Paper points are used to dry canals, place medication, and to take culture of the canal. Paper points are absorbent and are supplied in various forms, from X-Fine to Purse. Also available are color-coded paper points to match the color coding of reamers and files. The colors change when they absorb moisture. They come conveniently packaged and are supplied sterile or non-sterile. Locking cotton pliers are used to transport paper points to and from the tooth being treated endodontically. Gutta percha. Gutta percha is used to obturate, sealing filling the canal. It is a thermoplastic material that is flexible at room temp, yet stiff enough to be placed in the root canal. Gutta percha cones are supplied in graduate size from X-Fine to large. Color-coded gutta percha is also available to match color-code reamers and files. Thermal gutta percha endodontic obturation system, Thermafill endodontic obturator are also available. These systems include metal cores coated with gutta percha. The gutta percha and cores are heated with units specific to the system or with an open flame and then inserted by hand or with low-speed hand piece into the root canal. Silver points are rarely used anymore to obturate the canal. They are used much like the gutta percha but are not as flexible. However, the silver points may be removed and replaced with gutta percha. Irrigation solution or enema. Irrigation solution. During root canal treatment, the root canal is irrigated frequently to remove debris. There are several solutions used to rinse and remove materials from the canal, including the biomechanical cleaner sodium hypochlorite, which is household bleach. This antimicrobial solution is mixed with water, 50-50, and load into a Luraloc syringe. The canal is irrigated with the sodium hypochlorite water solution, which disinfect and dissolve necrotic tissue. Care must be used not to get any of the solution on the skin, as it may cause irritation or on the patient's clothing. Parachlorophenol PCP is a combination of 35% parachlorophenol and 65% camphor. It is used as an antimicrobial agent in the irrigating of the pulp canal. It is also administered in an irrigating syringe.